fire and water acupuncture, I think, has been introduced for the first time in all of the CAE events. Anybody has heard of fire and water acupuncture? All right, so today I'm sure you'll go home and you'll pursue this even more. In acupuncture, we always say that emotions are the main causes, correct? But ask yourself honestly, who looks at the emotions? Do you really ask your patient, आप गुस्से वाले हो, आप डरते हो, आपको बहुत चिंता है, पूछते हो? अच्छा, very good. And based on their emotions, you can arrive at the element which is disturbed. You can confirm whether the emotion and the disturbed element tallies. Correct? Any patient saying कि बहुत गुस्सा है and his symptoms don't match, that means he himself doesn't know what is happening. Correct? Anger is linked to which element? Read even more. I agree with you that in most of the textbooks, anger is connected to wood, but there are other elements that are also influenced by anger. You will come to know step by step. In today's times, where stress is considered to be the main reason of most illnesses, we fail to recognize how the stress is affecting. So today is also the day where we are going to do a very important experiment. I'll use the word experiment because we are going to make two of you, okay? I'll need two volunteers who are sensitive to energy, okay? Understand this. Understand this concept, sensitive to energy. You have energy in you, correct? Two patients who are sensitive to energy, and we will give you a needle. Only thing is you will have to sit quietly with the needles for about 20-25 minutes, and you will have to give a feedback as to how you are feeling with these energy points, which is correlated to the topic for today. Yes? Two, preferably one male, one female. We can make you sit here. We will give you the points. आपको बैठना पड़ेगा. Anybody ready? Yes, one. All ladies are lifting their hands up. All right, please come. Okay, two ladies come. Gents को energy बहुत है लगता है. Anybody, you come, please come. Chirag. On the chair. We'll be giving you, so you will be able to watch the event. We will be giving you the points, and two or three of you, okay? We will be giving you just 4 points, only 4 points. Now what you have to do, feel the energy right now, and afterwards when we remove those points, okay, you please tell us what is the difference. Are you clear? Three of you, all right? Okay, I think 3. We'll take some other person sometime else. Okay, so Dr. Chirag will give the points, and while he is giving the points, let us continue. Everybody has heard about the element theory, correct? We look at the 5 elements and we think that the elements, organs, their correspondences is a straightforward thing. And the cycle, okay, is supposed, the life cycle, where does it start from? Where does the life cycle start from? Which element? Wood, water, wood, water. Last choice. Water. Water is the spark of life. Wood starts the growth. All right? You look at a seed. When you plant a seed, what do you have to do first? Give water, right? And then the seed sprouts. The beginning of the sprouting is where wood comes in. Then it rises vertically, usually, all right? So fire also rises vertically, and that is fire. Then it matures, transforms, gets nourishment. Then you enter the which phase? Earth phase. After fire comes earth. After maturing, it gets its boundaries, it solidifies. That's where metal comes in. And after it has matured, after it has solidified, after it has reached its peak, kaam khatam. Then is the aging process, and ultimately it has to merge back into water. So water is coming twice, at the beginning and at the end, correct? So what is the role of this fire and water? It is said that if you don't understand the fire and water mechanism, the technology, you have not understood the element theory. All right? So let us begin with the presentation. Fire-water balance, the ancient principles. This ancient acupuncture concept reveals how fire and water as fundamental forces create the essential balance within the human body. Now, we have just discussed that the 5 elements are phases of transformative energy. Please remember, whenever you talk about elements, talk about phases of transformation. Elements are not something solid, they are not material. Elements are called phases. It is the transformation. So from the seed to the sprouting is transformation. From sprouting to the growth is transformation. So elements is all about transformation. Correct? So we have the wisdom followed by growth, transformation, nourishment, refinement. We will not spend more time on the phases, but I want you to look at the main points of the water phase. What is water phase? Deepest energy reservoir. All right, look at the cursor. The deepest energy reservoir. And the fire, it is the radiant energy illuminating our spirit and awareness. We are restricting our attention to water and fire. And the 5 element energies, they are the invisible channels. They form an intricate network delivering vital chi to every organ, tissue and cell. Okay? Now, this is your first take home value. What is energy axis? If you have a glass of water and you keep it on the table, will it flow? It will not flow. In your body, the energy is flowing, correct? What is making it flow? Why? That is the concept of energy axis. That means in our body, the energy points, okay, they by themselves are static, potential energy. They need something so that the energy would flow. So when you give a acupuncture point, 1 point, you are stimulating just 1 point. The results are say 10%. But when you stimulate the axis, the results are 75%. And when you make a circuit of axis, 1 axis, second, third, in continuation, the results are 100%. So what you must take home with you today, always treat the energy axis. Correct? Now, what are these energy axes? Where do they come from? कहाँ से आया ये? सुना है कभी energy axis? सुना है. Use कैसे किया है? That is what you have to decide today. In our body, all energies, they flow on an axis. So when you treat, you must always treat an axis. I have seen most practitioners treat random point. This is good, this is good, this is good. Okay, you have asthma. Okay, which is good? CV17 is good, lung 5 is good, K3 is good, Baihu is good, and they give all the points. It is known as random acupuncture. Random acupuncture will give results. You give an acupuncture point anywhere in the body, you will get results. Correct? Why? Because by correspondence, everything is linked to everything. Correct? No? Don't say yes, huh? If I'll throw a googly at you. Correct? So, most practitioners, they want fixed formulas. This is good, 4 points good, 10 points good. And some modern trends are going that way, fix the points. Which is good for Parkinson, this 4 points are good. Which is good for asthma, this 10 points are good. Nobody talks about axis. If you don't give the points on the axis, you are doing half the job. Now, what is the danger? I'll tell you something which is shocking. All of you may be thinking that acupuncture is safe, correct? Yes? Is it safe? 100%? Is it safe? I can tell you it is more dangerous than the strongest modern medicines. Why? Because when you give a point which is not correct, you are disturbing the core energies of the person. When I was attending couple of charity organization camps, okay, they used to conduct free acupuncture camps. Every weekend, Saturday, Sunday, volunteers would come, they would give acupuncture. So once I observed, I was there for 3-4 months, they would be giving points on the knee, okay, knee joint pain, very common. And people are happy, okay, give acupuncture, For the knee pain, patient is happy, pain is less in 2-3 days. And there were 2-3 patients aged between 50 and 60. The knee points were given. And after 1 month, 1.5 months, one by one, these patients started developing heart problems, cardiac issues. Now, the patient may think, okay, what is the connection? Okay, knee pain is different, heart problem is different, what is the connection? But when it repeats one after the other in similar cases, you have to think. And this is the theme for today, research. Dr. Komal is here, she is going to tell you how to do research, how to be vigilant in your practice. That if you are giving the wrong point, is it damaging the health of the patient? You have to be very, very careful. So these 3 patients started developing cardiac issues. They started going to the cardiologist. And that is when it came to our notice that some of the points that were being given, it is as if wo chua, the rogue chi, was jumping from one place to the other. There is this concept, the chi can go from one place to the other. Normal chi also can go, poisonous, toxic chi also can go from one place to the other. So if you don't treat correctly, you can internalize the problem. So that is why the energy axis knowledge is very important. All right, so let us go through what is the energy axis. Energy axis represents a sophisticated understanding of how chi flows. Okay, now there are 6 primary energy axes, 6 primary, okay. They are the 3 yang energy axis and the 3 yin energy axis. Now, up till now, you were all knowing Tai Yang, Shao Yang, Yang Ming, correct? You have heard these names? But very few people correlated to these axes as energy axis. Tai Yang, Shao Yang, Yang Ming. And on the other side, Tai Yin, Jiu Yin and Shao Yin. They are the 6 energy axes. That means, technically, when you treat a point on one of them, you have to complete the axis. Alright? So, how to complete is what we have to discuss today. Now, read very carefully, okay? We'll go through these and you will find that most of the problems that you encounter in your day-to-day practice will be covered by the water-fire axis. So the brief description here is Tai Yang is known as your greater yang, bladder and small intestine meridians. It is your barrier against cold, external pathogenic influences. Now most of us were led to believe that lung is your protection against external chi. But I found in my practice that when I used Tai Yang, bladder and small intestine, it worked much better. All of you, which are your favorite points? Come on, let me ask you. LI11, yes? Favorite point? Okay. U20, yes or no? Compare against LI11 and SI3. What is the ratio you would treat? LI11 you would give say 100 times, SI3 you would give 10 times. But this is the difference. Then we have Shao Yang, that is triple energizer gallbladder. Adaptability. आपके पास पेशेंट्स आए होंगे, मौसम बदलता है, बीमार होता है ना? From summer to rains, rains to winter, change of season. When the person falls sick, what you have to treat? Which axis? Shaoyang. Then you have Yang Ming, deepest of the Yang layer. What are the meridians? Large intestine, stomach. That means very randomly we are using large intestine and stomach every day, routinely, correct? Stomach 36, Li4, Li11 and whatnot. And these are the deepest. So to kill, मक्खी को मारने के लिए आप मशीन गन लेके आ रहे हो. Think about it. You are jumping directly to the deepest channel to attack a superficial problem. Okay? And these are the three yin energy axes. They are the interior nourishment. So we have the thigh yin, the lung and the spleen, Jai yin, the pericardium and liver, and Shao yin, heart and kidney. So if you look at all of them, the last column shows that the Shao yin embodies the fire-water axis. Shao yin is very important, the fire-water axis. Okay? It is the most essential vertical connection in the body. All right? So we have the functional hierarchy. Superficial is Tai Yin and Tai Yang. Come on, repeat after me. Which are the energy meridians of Tai Yang? SIUB. Which are the meridians of Tai Yin? Come on, you must know this. Shaoyang, meridians connected to Shaoyang. Jiayin, deep layer. Yangming, LIST, list. Shaoyin, heart and kidney. So this is the deepest layer. And you are treating it without respect. Next slide. Next. Now we come to the functional element energy axis. All right. So behind the six, we describe the six energy axes: 3 yin energy, 3 yang energy. The condition which I have told you, be careful. Always complete the axis. All right. So when you treat one, always treat the other. Learn how to do it. You will be able to learn it easily. Now, which are the functional element energy axis? Beyond the 6 chi planes, traditional acupuncture recognizes functional energy axis based on 5 elements. Okay? Next. So, we have these 3 axes. Okay? We have the nourishment axis. The another name for nourishment axis is which cycle? Nourishment cycle of the 5 elements. What is it called? Sheng. Shenko, you have heard of it, right? Homeostasis axis, the axis which balances. If the earth energy is becoming excess, who is the policeman? Who is the policeman of earth? Wood. What do you have to learn? Nourishment axis, they follow a pattern. All right? Nourishment from water to wood to fire to earth to metal and back to water. This is the nourishment axis. Energy flows. Homeostasis, that is control, balance. If one thing is going up, it controls, brings it to balance. Homeostasis. So you have to understand the homeostasis axis. Okay? So if metal is going excess, policeman कौन है metal का? Understand the axis. These are energy axis. All right? Whenever you Give acupuncture, always look at axis and you will never go wrong. And you will never find the side effects, the dangerous effects of acupuncture when you balance the axis. And lastly is the 5 healing axis, which is not commonly found. These are the axes which you have to stimulate to actually heal a problem. Okay? Now coming to the most important part. Which are the 2 mega energy cycles in the body? Okay? Next. This is the most important slide for today. The 2 mega energy cycles. The first cycle is from water to fire. Okay, let us skip the wood for the time being. From water to fire. What I have called it? Mental chi. So if this energy cycle is disturbed, okay, the bigger cycle, mind is disturbed. All right. Now look at it carefully. Water, wood and fire. Aren't they linked more to the mind? Correct? Study carefully. Water, wood, fire. Water gives you the intention to live. क्यों जीना है? Wood gives you the courage to decide how to live. And fire gives you the energy to do what you have to do. Now, let us ask a googly question. Who wants to live till the age of 100? Nobody? You want to live till the age of 100? आप गाना गा लो Who wants to live till the age of 100? Honestly, हाथ ऊपर करो, ऊपर डरो मत. My God. And who doesn't want to live till the age of 100?
There is nothing 100%. 99 can also be considered 100.
See, the people who raised their hands when they said that they want to live, the will to live, okay? Your kidney energy is strong.
Want to live longer but not prolong. Yeah.
सर आप मास्टर हो, आप हमें गूगली मत भेजो. And those who don't want to live, जी के क्या करना है? ये लाइफ वैसे भी, ये मैराथन भी दुखी कर रहा है, कोई साथ में कोई है नहीं है, उधर भी दुखी, बाजू वाले से दुखी, वो बाजू वाले की बीवी से दुखी, किसी का मर्सिडीज से दुखी. So those who feel कि क्या जी के करना है, their fire is disturbed. तो आज जिन्होंने भी हाथ ऊपर किया, आप समझ लो कि आपका फायर और वाटर का क्या पोजीशन है. हाँ, अभी मैं दोबारा पूछता हूँ, 100 साल जीना है? Water to fire is giving you mental energy, mental chi. Okay? It gives you emotional balance, mental clarity, more consciousness, and it is the foundation for your cognitive functions. Whenever you see a mentally disturbed patient, always treat the water-fire axis and you will see good results. And the second is from fire. See, from this water to fire is mind. From fire to water is your physical energy, where earth comes in, metal comes in. It is your physical energy. You will look at it from the element cycle point of view. And what is the fire water energy doing? It is ensuring warmth. It descends to activate the lower body. cooling the essence, which rises to temper the excess heat. It maintains physiological equilibrium. So we have two mega energies, okay? Water fire cycle, fire water cycle. Now, what is the water fire axis? Now, why I am telling you this, when you give a treatment, okay, you have a patient, let us say you are giving 10 sessions. In all the 10 sessions, will you give the same points? Tell me. Then what will you do? Will you give same point? Okay, day 1 you have said back pain, na? Local points you give. Okay, UB 40 you give, UB 57 you give. You have identified, ये point अच्छा है. 10 treatment वही दोगे आप? Yes? What will you do? How will you make your strategy? Come on, think. Huh? Let us say back pain and you have identified, okay, these points are good, HTJ points are good, GB channel is good or whatever. You have identified 6 points, okay. Will you give the same points for 10 sessions? How will you make a strategy? So at the end of this presentation, I have given a small note that your strategy must have 4 types of treatments, 4 types. Okay? So which are the 4 types? We will come to know. And you must combine, okay? So we call them intercurrent. So when you are giving the main sessions, बीच में intercurrent session दो. Like one of them should be water fire axis. One of your intercurrent, बीच वाला, should be water fire axis. Alright, next slide. So the water fire axis, it is the balance between the most yang and the most yin energy of the body. Okay? It is fundamental to life. It governs consciousness, vitality, reproduction. Now look at the clinical implications. Consciousness, vitality, reproduction, longevity. Next. Then, what are the key conditions? Insomnia, anxiety, menopause, infertility, chronic fatigue, physical vitality, emotional balance, spiritual awareness, covering almost all aspects of life. This is the clinical significance of water fire axis. Next. So, what is the core dynamics? Fire, as we all know, now repeat this, fire is, it represents heat, the mind, joy, consciousness, it is the emperor, whereas water, cold, essence, willpower, fundamental reserves, downward movement, it is the root of life. Next. Now if you look at this, water and fire, it is said that your DNA is nothing but water and fire. Can you see the strands? This is how the water and fire is supposed to interact in your body. Your whole DNA, the strands, one is water, another is fire. Look at it. So, deep down, your constitutional problem, genetic level problems are going to respond to this. Whenever you have any difficulty, one of your treatments, you are just going to treat the water fire. And this is what they have got right now. The water fire axis has been stimulated. So let us ask afterwards, do they want to live till 100 or not? Alright, you have to be conscious about your energy. So fire and water is the symbol of DNA. That is how important it is. Alright, next. Understand water energy. What water energy is doing, how do you recognize its imbalance? Next. Water energy connected to willpower and purpose. Many a times in the ICU, the doctors tell, we are doing everything, लेकिन ये patient जिंदा नहीं रहना चाह रहा है. Heard of it? Technically, reports are normal, everything is normal, and yet the patient is sinking. ये जिंदा नहीं रहना चाह रहा है. Last month, I had a family who is with me. Their only child, okay, only child, went to the factory at Vapi, and while getting down from the train, he slipped. He got down from the moving train and his legs were crushed. Immediately treatment was done. Both his legs were amputated. But you have seen many cases, right, without legs. Now, this 28-year-old boy with both his legs amputated, he was in coma, and when he woke up and when he saw कि मेरे दोनों पाँव गए, he was married last year, 1 year of marriage. And from that day, his health started deteriorating, and within 3 weeks he died. Why? He lost his will to live. And in modern times, we find that most of the people don't have the will to live. Actually, I'm telling you. They find life to be too strenuous. बहुत stress है. यहाँ allied का stress आ रहा है. यहाँ उसका stress आ रहा है. And with this stress, the will to live goes down, your kidney energy goes down. जी के क्या करना है? And this is evident. And I asked this question many times, 100 तक किसको जीना है? And usually the answer is, जी के क्या करना है? The will to live is not existing. And that is also to be considered. Okay, don't just be happy, हाँ point दे दिया, pain चला गया, I am happy, पैसा मिल गया. No. Treat the patient from the roots. Alright, next. Water, what does it govern? Skeleton, nervous system, brain, endocrine system. See the areas of action. Water, plain thing as pani, jal, neer, आप जो पी रहे हो. The simple thing like water and you don't know its importance. It is governing all of this. It is the deepest physical and energetic infrastructure of your body. Correct? This is the importance of water. Any of these clinical conditions and you will need to balance water. And water fire balance does miracles. 2 or 3 points, that's it. The more points you give, the more confused the body is. Alright, next. So, the water energy flows with profound wisdom. It is the blueprint of your inherited potential and to adapt to life-changing circumstances. Next. The water energy components, left kidney, right kidney and jing. You can identify what are the symptoms of the left kidney, what are the symptoms of right kidney, what are the symptoms of jing. Anybody knows the symptom of left kidney and the symptom of right kidney? One difference. You have to read this, okay, when you go back. Next. So, this is a nutshell, the jing. It fuels growth, development, reproduction, overall vitality. So, when the child is not growing, ये child बढ़ नहीं रहा है, height नहीं बढ़ रहा है, delayed milestones, you have to think of jing, which is the energy is not being used. Left kidney, moistening quality. I give a lot of importance to this. Okay, it is the cooling fluids, nourishment substance. And we have so many illnesses where the body is going dry. Like we have even simple things like psoriasis, where the skin becomes very dry and scaly. Atopic dermatitis, skin becomes dry. Lung fibrosis, it is considered to be an impact of dryness. It is drying. The left kidney yin, is missing. And the right kidney is metabolism. Metabolism slow hai. All your endocrine problems linked to metabolism. All thyroid patients must be treated with the right kidney. All obese patients must be treated with the right kidney energy. All right, next. So these are the primary functions of the left kidney and its deficiency. Next, we have gone through this. Next, the right kidney, we have discussed low energy, feeling cold, lack of courage, weak knees, low back pain. When you have a patient with back pain, which is bread and butter for acupuncture, always treat this fire axis with the right kidney as the energy, as the focus. And you'll see miracles. Right kidney energy. Alright? So, when the right kidney is robust, the individual feels warm, energetic, motivated, vital. They possess courage, decisive action, metabolic fire is good. That is what you need. आप सबका right kidney weak है आज. Next. So, signs of kidney essence deficiency. You can take this down. Energy and willpower, chronic tiredness, reproductive issues, premature aging. Today we find white hair from the age of 10, from the age of 15. This is being depleted in today's lifestyle. Alright? Next. Fire energy. What is fire energy? It governs Shen, the spirit of awareness, spirit of truth. So you will find when fire is strong, the people cannot tolerate nonsense. And usually the wives cannot tolerate the nonsense. Husband के सर पे डंडा होता है. Okay, so fire, they connect to truth. Any nonsense, anybody lying, anybody doing wrong things, mischief, fire is going to flare up. Nobody can stop it, correct? અમારા મેડમમાં બી ઘણું ફાયર છે હજી પણ. મને ફોન પર ઘણું બધું કે આટલા સિનિયર સિટીઝનને તમે લેક્ચર આપવા બોલાવો છો, કેમ બોલાવો છો? તો મેં કીધું સાહેબમાં હજી એસન્સ ઘણું છે. Correct. All right. So this is the fire energy. It governs vital systems, blood vessels, circulation, consciousness. Next. There are 5 fires, not only one. So if you look at it, you have liver fire, heart fire, stomach fire, lung fire, kidney fire. All your illnesses, whatever you can think of, are covered. Because this fire is the toxic fire. Okay? How do you identify liver fire? Okay? Red eyes, headaches, hypertension. Usually liver fire arises out of emotion. What is heart fire? Excessive consumption of spicy food. I have seen people eat that green chili raw. Who eats green chilies here? Who likes green chilies? Sholapur, Kolhapur, I think I've heard Kolhapuri mirchi. Once I was in that area, I had ordered some usal misal. One piece and my God. So the water energy started flowing. Itna tikha tha. Very spicy, and they eat मजे से और मिर्ची डालो. I think they even serve green chilies, correct? Extra to be put. I don't know how they eat. But their heart fire is definitely going to be affected. Alright? It manifests as insomnia, mouth ulcers, palpitation, etc. Stomach fire. Usually irregular diet, improper diet. Okay? Excessive hunger, acid reflux, gums inflammation. You will find out, okay, stomach fire is a problem. Lung fire, very heavy coughing sound, like a trumpet. Pow, pow, you have heard of it, right? So when you hear that sound, if the sound is soft, it's not lung. Don't treat lung. Only if the sound is loud, treat lung. Kidney fire, usually deficiency of kidney yin, it's an empty heat. Night sweat, low grade fever, menopausal hot flushes. Kidney fire. Next. So now how to balance the water fire axis. Okay, now we are coming to the main point. Now this is your standalone treatment. Whatever is your course, 10 sessions, one treatment out of that you must do what is known as water fire treatment. That's it. बाकी कुछ point मत देना. Separate water fire and you will see the energy levels. We are going to ask them. कैसे लग रहा है? आप तो हवा में उड़ रहे हो. Just notice your energy. I want a feedback, honest feedback. Okay? So, water fire balance. When water is deficient, it is a problem. So, you have to tonify the yin points. You can use herbs, adequate rest, reduce your stimulants. Today we are having lot of stimulants. Everybody wants whiskey, tobacco, coke, everything. The world is fighting alcohol, but the worst enemy nobody is fighting and which is everywhere. Gali gali mein chor hai, gali gali mein poison hai. Nobody looks at it. In fact, you take your children there. Khao beta, khao, sugar khao, chocolate khao, bagel khao, Belgium waffle khao. You are poisoning your child happily. And at the age of 40 उसके दांत जाएंगे, फिर वो implant करेगा. Modern technology implant. Correct? You are damaging your life. So this is how you have to understand the balancing. And the fire is deficient, the whole system becomes cold, depression, lack of motivation, poor circulation. Correct? Which you see very often. Depression, so common nowadays. What is the problem? Fire. So by doing this treatment, water fire axis, you can do so much. Don't give more than 2-3 points. In another session, you can give whatever you want. I knew an acupuncturist. They wanted to stimulate each and every point on the channel. All points on the channel they wanted to give. Channel majboot ho jayega. You agree? Have you tried? You must try, no? Experiment once. Correct? Take lung channel, give all 11 points, lung 1 to 11. What happens? I have tried it, 40 years back. Now I am not trying anymore. What will happen? Sir, your experience, if you treat all the points on the channel, balance ho jayega na? Point to think. There are practitioners who are doing it. All channels, talk, and they keep it for 1 hour. It's happening. Next. Restoring harmony. Now comes the main thing. I have given all of you a page. Okay? Next. How will you treat? Acha. Okay, sorry. The paper is lying in my car and it could not reach here. We will give it to you. But I will send it by WhatsApp. No, it's okay. Acha, you have it? Please distribute. Just send it across, they will spread it. So, what will you do if there is deficiency? Which will be the first 2 points that you give? So, tonify the mother element of the affected meridian. Okay? This is your formula, your take home value. Please spread. Let them distribute. Give one here also, the front line. This is one of the most common charts that is available. Correct? Nipa, give me one page. One. So one of the most common charts you see, correct? The 5 elements and deficiency, tonation, tonification and sedation formula. Now look at the kidney meridian, okay? Kidney. Under deficiency, what do you see? Lung 8, kidney 7. What is the formula? Deficiency, first tonify the mother element. What is the mother of kidney? Of lung. So what do you see? Lung 8. Correct? And then you tonify the master point of the mother element on the meridian. On kidney, the metal point. Correct? This basic formula understand. Advanced to baki alag hai. So what will you do? So if there is deficiency, first tonify the mother. So mother is going to give the energy. Then the same metal point on the kidney meridian is going to receive the energy from the metal. So these 2 points you will energize the meridian in deficiency. Works fantastic. And you will have to sedate the controlling point. So whatever is controlling water, जो water को कमजोर कर रहा है उसको control करो. So what is controlling water? Earth. So you are sedating spleen 3, earth point. And you are sedating the earth point on kidney channel. That's it. Are you clear? So next. Excess, the reverse applies. The same formula here. In excess you first sedate the child. When you sedate the child, आप रास्ता कर रहे हो. Energy which is excess is flowing away. It is draining out. And sedate the master point on the child meridian. And tonify controller and tonify the master point. Next. Okay, so this is the vital formula. Fire excess, I have given a sample here. If there is fire excess, you have to sedate. Okay, you have to drain the fire into earth. So you can give heart 8, the earth point. Then the earth point on earth meridian, spleen 3. This is what you have to sedate. And then you have to tonify water on the fire meridian and tonify water on water meridian. This is the formula. Alright, next. So this is the kidney deficiency. Now these are the patients. Next, which we have discussed already. Next slide. Now I told you which are the 4 categories of treatments you have to give in a course. Whenever you are treating a patient, you are giving 5 sessions, 10 sessions, what do you have to do? Acute management you are doing, like you are giving your selection of points. We call it acute management. Okay. Then you give element balance points, a separate session where you are looking at elements only. Then intercurrent session is where the axis, water fire axis. And last is constitutional harmony. Your treatment must have these 4 sessions. Alright? So if you plan it in this way, first 1 or 2 or 3 sessions do acute, give relief, then give intercurrent, again give regular, then give element, again give, and last give constitutional harmony points. बीमारी वापस नहीं आएगी. Next. Okay, so we have come to an end. These are some of the specialities that I teach separately. Advanced scalp acupuncture, magnetic probe, pulse technology, energy systems, pressing therapy, fascia and lymphatic acupuncture, meridian exercises, etc. etc. Next. The most important slide. So I have completed in time within the 60 minutes allotted. I hope you have understood. Now we remove the needles and we call them here and tell them, ask them what have been their energy experiences. Till that time, any question? Fire, water, acupuncture, everybody understood? Any questions? Is it clear? हाँ भी नहीं, ना भी नहीं. Understood? आप करो पहले. So that task I am leaving to Dr. Komal, who is next. Research, how to do research, how to understand this. She is going to highlight things. So all of you who have finished, needles are out, please come here. 30 seconds each. Tell me what you have felt. You took the needles, right? Acha. There. All of you please come here. Finished. Till that time, if you have a PPT, you can upload, or if you have a pen drive, whatever.
I have one question. जैसे देर आर yin and yang, दोनों भी है मेरे साथ में. तो fire and water axis, I like that concept, genetics, because I am also interested in genetic engineering, because that is the what he told about fire and water axis, that is genetic engineering of the future, according to me. And I am also very keen in this topic, because that is the future of the world, that is the future of the human beings, and that is how it has to go. And I also had the thought, in acupuncture we have already into it, and the young and the modern medicine, the perspective, they are into it, maybe can't say on commercial backgrounds, but then this is the future. सेकंड थोड़ा डिसएग्री करने में पॉइंट है, सर से भी बात किया था मैंने, डॉक्टर बेरम जी सर से, कि घुटने के पेशेंट को अगर नीडल करते रॉन्गली तो उनको हार्ट अटैक आएगा. सो डॉक्टर कोमल मैडम हैज टू डू एनालिसिस ऑन दैट, शी हैज टू सबमिट द रिपोर्ट. से पहले ही मॉडर्न मेडिसिन में और बाकी सारे पैथीज दे आर आफ्टर अस, कि ऐसा कुछ पॉइंट मिल जाए तो इनको हम लोग खींचे. सो if you have really have that data, it is quite interesting.
I can give you that. Okay, I'll explain.
Thirdly,
how.
और एक है सर, कि in your presentation we spoke about homeostasis axis. So if there is a homeostasis axis, how could the heart attack come?
Because the homeostatic axis is overpowered, it fails to function. That is when the disease happens.
Okay.
Your body has homeostatic functions. Why do you fall sick in the first place? It is overwhelmed by the disease forces. All right? Now answering your second question, because technically all of you are designed by nature not to fall sick. But why you fall sick? First, दिमाग खराब करते हैं. Second, खाना खराब करते हैं. तीसरा, body को खराब करते हैं. Correct? So your homeostasis functions are overwhelmed. They cannot function. अभी daily, if 3 times in a day you are eating 5-star, one bar, what will happen? Your homeostasis 1 day, 2 day, 5 day, 50 days. After that, okay? So homeostasis is natural, but it can be overwhelmed. Now, how to know whether that point in the knee is damaging the heart or cause the heart attack? How to know? Correct? That is your question. So in those times, right from those days, I used to do pulse diagnosis also. I used to also do various other criteria, the analysis of the patient. And when you treat these patients, now what happened in one of the cases, the heart attack patient came back to us, okay, post heart attack management. We treated the heart attack, the knee pain came back. So in homeopathy, sir, this is a big topic. In homeopathy, there is a concept that the disease, if it migrates, and when you are healing the disease, the old symptoms come back. Okay, so that is showing some of the signs of migration. Okay, so this is a concept. However, it needs to be monitored in a proper way. We'll hand over the baton to Dr. Komal.
I am surprised it happens so sudden because we have so many levels of meridians, and your son will also have a talk on extraordinary meridians, which really balances everything to the last extent. और आखिरी एक दिन तो मरना है, लेकिन इतना सडन हो जाएगा, I was surprised.
Sudden, see, we have cases where
we need documentation.
We need documentation.
That will be very scary if it comes true.
Yeah, it is, because see, we have seen so many cases. You apply a steroidal cream, in 2-3 days asthma develops. Okay, the suppression, the migration, these are all very common things. So there is no such thing as sudden. It is the intensity of the toxin. It is how strongly it is suppressed. What is the severity of the problem? There are multiple factors. It is a good point for debate. Myself, Dr. Sachin, Dr. Komal will do the research.
We are treating knee and spine, so it would be all of a sudden it happens. It is really dangerous. It could be syncope also, ma'am. Can't say.
We'll yes.
Thank you.
Thanks for your inputs. All right. Thank you very much.